truly feel for all of these folks. They're fighting on the front lines, and many of them are also fighting their own stress and depression.
Yeah, healthcare workers say they've been struggling with mental health through COVID. Brittany Thomason spoke with an ER doctor and a therapist about how to cope.
It's a struggle, but trying to kind of push through.
Kara Guerin works at Valleywise Health as an ER doctor. She knows firsthand the toll COVID takes on frontline workers.
It waxes and wanes. For me personally,
Phoenix psychologist Melissa Estavillo says many healthcare workers are facing depression and stress.
Burnout is probably, one of the first things that they experience. It's just feeling like they're still doing their job, they're kind of trudging away, but just feeling like it's harder to get it done. It's harder to have, that same kind of energy to be able to do the job.
At the beginning of the pandemic, Guerin worried about bringing COVID home.
my husband and I were very sad. My daughter, I think, was very sad and depressed.
She's back home, but still scared for her family's health.
And it just wasn't sustainable to not live at home. It just wasn't an option for long term for anybody's mental health.
When we're disconnected from family and friends, those are the things that tend to fill us up.
It's not a perfect solution, but she says if you can't see your family and friends in person, you can FaceTime, Skype, or Zoom with them.
Ideally, the solution would be for them to not work so much, or for there to be additional staff or resources.
But with the demand for more healthcare workers during COVID, it's not an option for many people.
Part of it is acknowledging the stress and getting the help you need.
Making time for counseling and self-care. Brittany Thomason, Arizona's Family.